Hey, Dr. Alessi, why do I feel exhausted even though my primary care doctor says my labs are quote unquote normal?
Yeah, that's a good one. This is one we hear all the time. So, the reason everything looks normal, but you still don't feel normal is likely because there's something deeper going on under the surface that standard labs, and I like that you use the air quotes, standard labs just aren't deep enough to uncover that. And so, this is when we start to do more digging, we do more comprehensive testing, and we find that someone has something like maybe dysbiosis in the gut. Maybe they have some type of subclinical autoimmune condition, a thyroid condition that if you just test the standard TSH and T4, you can miss that the thyroid is being burnt or stressed out by lifestyle stress, emotional stress, physical stress, things that, you know, are lifestyle related, but standard labs aren't going to uncover.
Welcome to Health Decoded, your number one source for real health information, with your hosts, Dr. Alessi and Matt Tack.
Welcome back to another episode of Health Decoded. I am your host, Dr. Alessi. I've got my co-host, Matt Tack, behind the scenes today, going through some high-level Q&As, some questions that we've received lately, both within our clinic as well as followers online, things that people seem to have some confusion around in the realm of health and wellness and functional medicine and natural health and all these things, longevity. And so I just want to answer some questions today. Hopefully this can provide some value for you, and likely you've heard these questions or have these yourself, then hopefully I can help you. So Matt, why don't you take us away, man, and get me started.
Hey, Dr. Alessi, why do I feel exhausted even though my primary care doctor says my labs are quote unquote normal?
Yeah, that's a good one. This is one we hear all the time. So, the reason everything looks normal, but you still don't feel normal is likely because there's something deeper going on under the surface that standard labs, and I like that you use the air quotes, standard labs just aren't deep enough to uncover that. And so, this is when we start to do more digging, we do more comprehensive testing, and we find that someone has something like maybe dysbiosis in the gut. Maybe they have some type of subclinical autoimmune condition, a thyroid condition that if you just test the standard TSH and T4, you can miss that the thyroid is being burnt or stressed out by lifestyle stress, emotional stress, physical stress, things that, you know, are lifestyle related, but standard labs aren't going to uncover. And the reason is, and I'll get off my soapbox. Standard labs are meant to look for specific things that can then be medicated. And so they look for a very small snapshot. We call it like the first 5 minutes of a movie. If you went to the movie theater and you watched the first 5 minutes, you can't claim to know whether it's a good movie or not. You need to see the whole picture. And that's what functional medicine is all about, is a deeper picture. So the reason you probably feel abnormal, but your labs look normal is that you don't have enough information.
Can you talk a little bit about cortisol rhythm dysfunction?
Yeah, cortisol rhythm dysfunction. That's a good one. So that plays into this, right? A lot of this is often missed. Um, so your cortisol, your circadian rhythm determines this, right? You should have in the morning this spike of cortisol should go up. This is almost like that alertness, that kind of get up and go, if you will. That should be about, through the midday, and then it starts to taper off, and it trends with the sun, right? Your body should then shift from cortisol going down to melatonin being produced. And so your body's going to now start having melatonin being produced to get you prepared for recovery, sleep, obviously, and your body reset. And so what can happen with cortisol rhythm dysfunction is in a case of someone who's wired and tired, right? They maybe stay up way too late on the screen, working, burning themselves out, stressed. They're high cortisol at night, and then their body's still trying to maintain that rhythm. They're going to wake up exhausted, even though they just slept for 8 hours. And so this can also be heavily influenced by nutrient status and vitamins and electrolytes. If we have any type of deficiencies, it's going to affect the way that our body is able to produce these hormones, and especially within the right context of the day.
With that being said, what are some hidden inflammation things that I should know about in my body?
Some hidden inflammation things?
Just in regards to hidden inflammation that I may or may not know is happening to my body. My knees hurt all the time. I feel brain fog, and I'm having little level of a neuropathy.
Yeah, when it comes to inflammation, we need to remember that inflammation is not the problem. Inflammation is a signal, a natural signal in the body. If you sprain your ankle, you want inflammation. It's going to help to heal that. If you have a cold, right? What is a fever? A fever is inflammation. Your body is actually producing that inflammation to fight off the infection. And so, inflammation, in a way, is a good thing. It's chronic inflammation that's elevated for too long that becomes a bad thing, because then the body is not meant to be in that state for that long. It's meant to be transient and temporary. And so when we have chronic inflammation, things like joint issues, things like brain fog or cognitive issues, what is driving that, right? So it's like inflammation is one thing that gives us a piece, it gives us kind of an intro. We need to dig deeper and find out what's driving the inflammation, because inflammation itself is not a root cause. Now, a root cause of inflammation could be uh, persistent infections in the gut, things like pathogenic bacteria that are taking over viruses or candida that are then causing this low level kind of systemic inflammation that then permeates outward. Leaky gut syndrome is a big one we see. People who have leaky gut are having more of a hyperimmune response to certain foods. And so then little things that they're eating on a daily basis, maybe even foods that you thought were healthy, are triggering a low level of inflammation on a constant basis. That low level of inflammation builds over time to become global.
Hey, busy professionals and parents, let me ask you something. Do you need help with your low energy, stubborn weight, brain fog, gut issues, or hormones, but you don't know where to start? Well, you're not alone. And the biggest problem is that modern healthcare is designed to diagnose disease, but often misses the dysfunction that begins years earlier as under the surface symptoms. That's exactly why I created the Functional Medicine Starter System. This is a structured, physician led process designed to uncover what is actually driving your symptoms, whether it's rooted in gut health, metabolic function, inflammation, nutrient status, or hormonal imbalance. No guessing, no generic protocols, just real data and a clear plan. So if you're tired of searching for answers, but you're not sure how to begin solving your health issues, go to the link in the podcast show notes to learn more about the Functional Medicine Starter System. Because once you have clarity, you can finally start to feel like yourself again. Now, let's get back to the episode.
How do I know if my gut is actually the root cause of my symptoms?
That's a perfect segue question. So to know if your gut is actually the root cause of your symptoms, you need to test. And so not just colonoscopy or an endoscopy like you would get from, like a standard GI doc. You need actual like internal tests, so like a stool test. And we actually do a combination of stool and urine to check for metabolites that are excreted into the urine as well. And so knowing, if the gut is the root cause of, say, joint pain or joint inflammation, we would want to look for certain markers, specific strains of gut bacteria that are able to control the way our body processes carbohydrates, processes proteins and amino acids, and then determines, whether or not our gut is actually healthy. And so when we talk about, again, leaky gut syndrome and the lining of the gut and the way that it's arranged, it should be tight. You should have this tight lining in the gut. Now, when the gut gets permeable and leaky, we start to get things going into the bloodstream that are going to trigger inflammation. The body can get confused when that inflammation is on long term and start to now cause the joints to hurt. It can start to go across the blood-brain barrier, and you start having cognitive issues, things like inability to focus, memory, ADHD, stuff like that. And so to get to the answer there, the way to find out if your gut is at the root cause is to test it. There's no other way. Guessing, uh, followers just following things on Google, it's not going to get you enough unless you actually look into your gut.
I've been having issues with bloating, reflux, constipation, and my primary doctor says that I have IBS. Can you speak into that?
Yeah, IBS is kind of a confusing one for people because IBS is really just a label. It stands for irritable bowel syndrome. It's really just the doctor telling you something you just told them. This is my opinion. Take it for what it's worth. But if you went to your doctor and said, "Yeah, my stomach hurts all the time. I feel like I can eat certain things and I have to run right to the bathroom," or when I have high levels of stress, it's like almost like nauseating to my gut, and they say, "Oh, you have irritable bowel syndrome." That's almost like they just repeated back to you what you just said to them with a label, if you will. And so it's always like, what is causing this irritability? Again, is it leaky gut? Is it the fact that your body can't tolerate certain things, that they come in and they trigger inflammation and almost like a low level of pain to your gut? Is it that your gut brain axis is off? You're living in this sympathetic state where you're stressed out all the time. It's not allowing you to get into parasympathetic rest and digest and actually process things. And so to get to the bottom of irritable bowel syndrome, it's a lot deeper than just the diagnosis itself. What is causing that irritability? And that's where we need to look into some level of gut testing.
I'm a 50-year-old woman, and I've been having skin issues, anxiety, and brain fog. Is that related to gut issues?
Yeah. So for a 50-year-old woman experiencing anxiety, gut issues, bloating, brain fog, this very well could be related to the gut. These are actually probably the most common symptoms we see with somebody who has something like SIBO, dysbiosis, and leaky gut. And that's usually like the triad that we find. I'd say that's 8 to 9 out of 10 patients that come in with these kind of things, we find that kind of combination of SIBO, dysbiosis, and leaky gut. And that's because those three things all kind of play on each other. When we have a dysbiotic gut, meaning the imbalance is off, there's too much of some strains, not enough of others that are maybe protective. We get these overgrowths, and that's the SIBO piece, right? We get this overgrowth of pathogenic or commensal bacteria, which then can damage the lining of the gut because it creates a level of inflammation. And so it's often that the SIBO and the dysbiosis can trigger and enhance and worsen the leaky gut, which then again is going to hyperimmune state, lead to inflammation and cause symptoms. Remember, the symptoms aren't necessarily the problem. What is that the root cause of those symptoms?
I've been to a number of doctors, including functional medicine doctors and primary doctors. None of them have really given me real answers or real results. What makes you different?
Yeah, well, I would say the two things, if I could put two things on what make myself and our clinic different, is that number one, I don't stop until I find the answer. And so if that's more testing, if that's more evaluation, like I'm not going to just take good enough as the answer. Like I need to know exactly what it is, not just to get a diagnosis. Diagnosis is cool, but again, it's just a label, but to get answers as to what is the dysfunction, what is causing the issue. And now sometimes that isn't what people want to hear, that, hey, what you're doing, your lifestyle, the way you're living is actually making you sick. I'm not afraid to tell that to people. And so that's probably what the second thing that stands out about us is that we are going to be firm in what's actually happening and what someone needs to do to fix it, but in an empathetic way that like, hey, I've been through that before as well. And I had to do a reality check on my state of health that, hey, what I'm doing is not actually setting me up for health, but the opposite, right? It was leading toward a state of disease. And so, it's all about what needs to be done without overdoing it. And then two, how do we get concrete answers with specific tests, not just standard broad range testing?
It seems like you have a lot of experience with the gut. What is your story?
Yeah. So my story when it comes to gut health and how that affected the rest of my body, it goes back to when I first became a doctor. I was a chiropractor and I was basically working in a very busy clinic, adjusting a lot of patients, treating a lot of people. I had just had my sons who are twins, and so I had a lot of stress in my life. And I was able to manage and kind of push through for a long time until I hit almost like a burnout state. At which point, it was my thyroid and my adrenal system was completely fried. And so, with some functional medicine testing, I was able to find I was having an autoimmune thyroid flare. I had to go deeper than that because the autoimmune thyroid condition wasn't really even the answer itself. What was causing that? And so I did some gut testing. I did some deep digging, really trying to figure out what was at the root of this. And it came back to be that I had leaky gut syndrome and a dysbiotic system. And so, again, unraveling all the way down to the bottom of that, I had to really undo and kind of retrain the way that I was living my life, right? Managing stress levels, managing my ability to cope with stress, as well as repairing the gut. From there, I was able to repair my gut. Now, that took me some time because I was kind of learning on the fly. I was like my own guinea pig, if you will. But through that, I was able to actually create like a system, and that's what we help a lot of patients with in our clinic, is this specific structure to completely restore the gut from a state of dysfunction and disease to a state of health and thriving, if you will.
So I've been to a number of doctors, and this has been a common theme. It seems like trending right now, but detox. And do I need a detox, or is this just a new trend?
Yeah, detoxing, I wouldn't even say detoxing is a new trend. It's been around for a while, the teas and the tinctures and stuff like that. And while it's not necessarily bad, it's like, is it necessary? And it all just depends on the person. And so the take on detox is that your body is detoxing 24/7, particularly at night when we're in a fasted state, right? We've been without food for 4, 5, 6 hours. Our body's able to tap into this like cleanup process, if you will. And that's why like middle of the night is where your liver's really active and your gut is processing and metabolizing things. Detox should always be happening. We should always be supporting it when it can get backed up. Think of like a filter. You have a filter in your house or in your car that's meant to trap the bad things and let the good things go through. And then what do? We have to clean that filter out, right? It's not like it's just going to do it itself. And our liver is much the same. It does need support from time to time, more so nowadays because we live in a toxic world. We're surrounded by plastic. The air is not clean. The things we put in and on our body are not what they used to be, our ancestors were eating. And so it's that much more important to make sure that we're supporting our body's ability to handle that and process that. And so regular detoxes are good, functional medicine detoxes in particular that support gut, liver phase 1 and 2 detoxification, as well as kidney health too, because that's important for that filtration. So, doing that on a quarterly or semi-annually basis, in my opinion, is a good thing. And I don't think it's a woo-woo. I think there are products out there that are kind of snake oily and claim to do one thing, but aren't quite, specific enough. So we make sure people understand what they're putting in their body before they do it.
So with that being said, who should and should not do a detox?
Yeah, people who should do a detox would be maybe people who have been exposed to mold and know it, people who suspect they might have been exposed to mold or heavy metals, people who consume a lot of things out of plastic. I to not to be too broad, but like if you live in kind of a first world country like America where things are very plastic heavy and you use beauty products that have things in them, like you should be detoxing regularly and supporting that process.
What are some of the toxins here in the United States that we're actually exposed to or even overexposed to?
Yeah, there's a lot in this country as far as toxicity goes. The biggest thing is going to be the plastics, the BPA's, the environmental toxins, the phthalates that we have on all the food products that you buy are covered in something or they're packaged in something. That can leach into the food. A big one people don't know is like plastic cutting boards. You cut your food up on a plastic cutting board, you're almost like cutting and shaving those little microplastics into the food you're about to eat. Um, Microwaving food in plastic, drinking out of a plastic bottle that's been sitting in the warm car that's possibly soaked into the water now. And so, just being more aware of these things, like get yourself like a stainless steel is always like a great idea. Or glass is very important. So if you have glass, I replace all my Tupperware with glass. Um, just to, again, I'm mitigating that. And this goes to kind of the what we call like the overflow effect when it comes to toxicity, right? So picture a cup. You got a cup, and every little thing that's putting burden on the system is now filling that cup up. When that cup overflows is when disease sets in, right? You were good here. you're a little less good here, here, here. And then one day, oh my gosh, I have rheumatoid arthritis. Oh my gosh, I can't think. My brain just turned off. I feel massively sick. Or these people who just burn out, like especially like high performing people. And it's because the system got overloaded and basically couldn't tolerate anymore. So then how can we undo that? How can we clear out or empty that cup, if you will? And that's through doing things like systemic, like regular detoxes, um, exercise, walking, movement, eating clean, managing stress, mindfulness. All these things help to, you know, empty that cup, if you will, that burden on the system.
I feel pretty good right now, but I always like to optimize. What are signs your detox pathways are sluggish?
Yeah, signs that you could have, slow detox. Your body needs support on that. Could be where maybe, not feeling well after food, maybe something that normally you could have eaten and then you eat it and you feel bloated or you feel, maybe foggy or unclear or just that discomfort. Things like skin issues, people who get like rashes or acne. Acne is a big one. Or even like eczema, then the gut or the liver is having problems getting things out and it's going to almost like expel that externally through the skin. And then other ones are a big one is going to be like cognitive function. Man, like one day I just like I couldn't think, or I don't have the memory. I'm not as quick as I used to be. When you detox your body and you clean up on the internal side, you feel that energy come back and you feel sharper.
What's the biggest mistake people make when trying to heal their gut on their own?
Oh man, that's a good one. Yeah, the number one thing that I see when someone is, oh man, I tried to heal my gut and it didn't work, is they just went and took a probiotic or some fiber, right? They saw some product online and they thought that was going to be, the marketing was really good and they thought that's going to be the gut fix product, right? Because it said it was. However, they had no idea what was actually happening inside their gut. Now, if you have gut dysbiosis, or in particular, if you have SIBO, where there's an overgrowth of certain bacteria, and you start feeding that with prebiotics and probiotics, you're going to make the problem worse. We see this all the time. Somebody got sold a probiotic or some kind of broad spectrum probiotic product, and they felt 10 times worse afterwards, was because they just fed a dysbiotic gut with more of the thing that was it didn't need. And so it's always number one. Step one is always elimination, right? If you have some kind of gut issue, you don't just put more in. You have to get rid of what's causing the problem in the first place. So it's always remove and eliminate, number one, then replace and rebuild on the back end.
Are I buy a lot of my supplements on Amazon, and I take a lot of probiotics. Where's the best source of supplementation?
Yeah, I would say you got to be careful buying stuff on Amazon. There's been a lot of, even more nowadays, lawsuits. These companies selling stuff that they claimed was something and then turned out to not be once it was tested. There's also these companies that are ripping off other companies, like some really good companies, like Now Foods is a great brand, but sold on Amazon. Turned out it was a fraudulent company labeling their products as Now Foods, and it wasn't actually quality supplements. So you have to definitely be careful. The supplement industry is not FDA regulated. And so that means kind of anyone can do anything. So there are companies that choose to have their products third party and FDA tested in a facility, and they pay money to do that. They spend a lot of money when they don't have to show purity. And those are the products we use. They're doctor formulated, so they are a little bit stronger. The potency of what you're going to get is a bit more, and so that's definitely something you want to manage with a provider, not just take willy nilly and hope it helps, because it can almost sometimes do more harm than good if you don't use the right amount. So, um, if I had to say, I would say don't buy anything on Amazon supplement wise. It's going to be, you get what you get. That being said, just do your due diligence. Make sure you research things.
I'm a 54-year-old male. I went through your gut program. I had phenomenal results, but I do love some of the foods that I had to eliminate. Do I need to be on the elimination diet forever?
Yeah, it's a good one. So, say you went through this process, you completely healed your gut because you were strict about it and you did all the work and we retested and found that, man, your gut ecosystem is thriving, you're doing really well, your symptoms are gone, you know, you don't necessarily want to end up back there, right? So there is a level of diligence you need to maintain, and that's just the truth of it. But we kind of operate by this like 80-20 principle. Maybe I kind of edge more towards like 85-15, but 80% of the time you're doing really good. You're eating the things that are clean, healthy, good for your body. That way, 20% of the time you can go to a birthday party and have fun, obviously not go overboard, drink up, 20 margaritas or something, but within balance that, it's not going to derail you. Because what happens is if you're 100% of the time always living super strict elimination, it's stressful on you to do that. Eventually that's going to become burdensome and you're going to quit. And then it's the other way. And you're 80% of the time you're not doing well. So, there is a level of balance, we would say, but it just has to be for your body and what works best for you.
If I could only focus on one thing to improve my long-term health naturally, what would it be?
If you had to focus on one thing if you had to focus on one thing for your long-term health, something you could do naturally, the number one thing I think you just do not ever skimp on is like sleep and stress reduction, right? Being able to recover from things, because you can always go get a workout in another time. You can always, focus on the healthy diet, but if your body's not recovering and doing the things it needs to repair and regenerate, eventually it will break down. And so if there's one thing you can do is optimize your sleep. That would be my number one.
Can you talk a little bit about nervous system regulation and how that improves my sleep quality?
Yeah. So when it comes to the nervous system, in particular, our autonomic nervous system, this is the one that, you know, essentially just kind of operates on its own, runs our body. We don't have to think to breathe, right? Your autonomic nervous system is making your body breathe. You don't have to contract your heart to make your heart pump. It's just doing it. And so we can, however, influence our autonomic nervous system consciously. And so that's where it gets pretty cool, is through doing things like deep parasympathetic breathing through our nose and expanding our diaphragm rather than like shallow chest breathing is going to shift our body more towards that parasympathetic state. Now, to that point, there are times where you want to be in a sympathetic state, right? Say you have a high level task to do, or you're in a meeting, you got a meeting, you got to present something to 20 people. It's better to be in more of a sympathetic state because you're going to operate better. You're going to be quicker, you're going to be sharper, you're going to have better outcome there. However, you don't want to be in that state when you're going to bed. And so sympathetic and parasympathetic balance, or being able to control that, is now like a superpower. Hey, I just worked out. I was in a sympathetic state really hard, got a great workout. How quickly can I get back to parasympathetic rest and recovery state as soon as possible? And that's what we talk about, is like almost that latency, or that transition, if you will. How do we shorten that gap? And so things like deep breathing, things like meditation and gratitude, right? Like mindfulness, connecting back to source, prayer, obviously, if you're spiritual, connecting with the creator, being able to get back to a state of calm and balance and not trying to control everything, is going to put you back into that state as well.
I'm a 48-year-old female. I am menopausal, and I have zero interest in having sex with my husband. Is that related to a gut issue or hormonal issue?
That's a loaded one. So if you're having libido or even like energy concerns, and you feel it might be hormonal, you feel it might be gut, it's probably both. And the reason I say that is because your gut is going to influence the level of health in your body that then determines if you're going to be producing hormones, if you're going to be having these optimal drives, right? And energy. So think of it like this: if you did some tests and found that your hormones were imbalanced, but you didn't look deep enough into like the gut, you could get on something like an HRT, or you could get on that and maybe you feel better, but for a time until, the gut catches up, because the gut is number one. And that's where most patients come into the clinic. It's always, okay, we want to address your symptom, but we want to look deep enough to make sure we fix it for good versus just make you feel better. And so in a situation like that, definitely need to understand what's going on in the gut ecosystem, as well as the hormone inflammation, thyroid cascade that could be going on as well.
I'm 37, married, and we don't have any kids, but we've been trying to have kids for a couple of years now. We've tried everything from in vitro to doing whatever we can to get pregnant, but we're unable to. Is this related to potential gut issue?
Yeah, so that's a really cool question. And this is actually something we just had a really cool transformation in the office. And we've actually had a few, probably 5 to 10, I'd say, in that range. I don't know on the top of my head, patients that we've helped to conceive who were having fertility problems. And were told that, like doing fertility medication was the only thing they could do, or like in vitro, right, was the only option they had, when we had to look deeper. And so what we uncovered was a dysbiotic, leaky gut that was affecting the way their body was able to metabolize and process and synthesize B vitamins. And so then if that's not happening, the body is not going to optimize, viability of growing a baby. And so we had to basically deconstruct everything. It was like a house. We had to take down the walls. We had to rip the floors out. We had to rebuild everything in terms of the gut to then build it back up to a state of foundational health. And then getting pregnant was actually easy for the patient. Just the other day, we had a patient who started to rebuild the gut. And what happened was, it was almost like she let herself calm, all the stress of it that they've been dealing with, all the doctor's visits. And then finally we found an answer. And it was like that alone, just that answer alone, that it was something with the gut, gave her so much like peace and calm. And she kind of like took the pressure off of it. And within a month, they found out they were pregnant. And so it's just so cool to see that's the mental connection to the gut as well, right? And the body in general. If our body is in this state of inflammation and disease and stress and fight or flight, growing a baby is not the priority at that point. The body is just trying to stay alive. So you have to think of it like that. And so, it's really cool when we see these stories, because that's like such a beautiful thing. But yes, that's something that we've helped a lot of patients with.
I'm 45. Last question. I'm 45, and my wife and I are trying to lose weight. And we walk every day, multiple miles. We don't eat a ton. We eat pretty clean, but we just don't seem to be losing any weight. Could this be related to something else?
Yeah, definitely. That stubborn weight loss issue that we see all the time. Man, I've been doing everything. I'm working out. I'm eating correctly. I'm doing. I'm really working hard, and I'm not getting that like ideal weight loss that I would love. There's something deeper going on. Likely some type of imbalance in the metabolism, and now likely even deeper too, because our gut health controls our metabolism, and specific strains of bacteria, things like Akkermansia, which can control the rate at which we process and utilize carbohydrates, balance insulin. And so if those things are dysfunctional, think of like there's a fire going on. The body's not prioritizing weight loss, it's prioritizing just equilibrium. And so what we find, and the cool part about functional medicine, is you don't need medications to lose weight. You don't need a crash diet. We just need to get the body back to a state of balance, and then it's going to do what it's supposed to do. And the input you give to it then will determine the outcome. So we get the body back to a state of balance and you're working out, you will get results. That's what we see. And so thank you guys so much for joining us today. Hope that was helpful. Again, these are just some of the questions we hear all the time. If this helped you, if this is a value to you and you think there's somebody you know or yourself that is dealing with these things, please reach out to us. We would love to be able to help. You can go to alessifunctionalhealth.com and send an inquiry in or book a consultation with us. Be sure to mention that you heard about us on the podcast. We have a special gift for you. Hope you have a great rest of your day. Thank you for joining. Your health is in your hands. I will see you on the next episode.
Thank you for tuning in to Health Decoded, where we break down the truth about all things health. and empower you to take charge of your well-being. If you found value in today's episode, please subscribe, leave a review, and share it with someone who needs to hear this. For more resources and personalized support, visit us at alessifunctionalhealth.com and sign up for our newsletter. To hear your questions answered live on the show, send them to ask@alessifxhealth.com. That's ask@alessifxhealth.com. Until next time, stay curious, stay empowered, and remember, your health is in your hands.